You're listening to the Dr. Cremata Show, empowering you to master healthy living by bringing you the latest research, expert interviews, and quick, easy tips you can incorporate into your daily life. The Dr. Cremata Show, not your ordinary health show.
Wow! I feel good. I knew that I wouldn't. I feel good. I knew that I wouldn't. So good. So good. I got you.
Good morning and welcome to the show. Our guest today is Dr. John Romano, a top-notch plastic surgeon that practices in Fremont, California. He's the choice of many nurses when they want cosmetic surgery, which really says a lot. He'll be discussing the pros and cons of plastic surgery and some of the newest approaches and techniques. I'm sure that you'll find his interview quite interesting and quite informative. And what can be done about menstrual cramps? Well, we'll address this issue at the request of a listener a little later in the show. We're then going to review yet another study comparing the effects of omega-3 fish oil supplementation with statins, which are the cholesterol-lowering drugs for patients with heart disease. And can this same nutrient also lower the risk for the main cause of blindness in the United States? Can this same nutrient also improve the health of an unborn child if the mother takes it? We'll see what the recent literature teaches us about that. We'll then bring you up to speed on what everyone should know about osteoarthritis, and you'll soon know just how good of an iron source spinach is or isn't. If you have a question that you want answered on the show, please call us at 866-521-SHOW. That's 521-SHOW. You can call anytime and leave a message with your question and your phone number, and we'll try to answer your question on the air. If you prefer to email your questions, please click on the email link of my website at drcremata.com. That's drcremata.com to send me an email personally. This is the same email and phone number that you would use to schedule a consultation with me at one of my 6 Bay Area offices. I specialize in multidisciplinary procedures, specifically shockwave and fibrosis release procedures, including manipulation under anesthesia, and these procedures are very effective for low back, neck, shoulder, elbow, and heel pain, even when many other treatments have failed over a long time period. So let's go ahead and look at the health in the news. Macular degeneration is a leading cause of blindness in the United States. In the August issue of the American Journal of Clinical Nutrition, we find a study that shows that a popular supplement substantially reduces the chances of becoming blind from macular degeneration. These researchers studied 105 patients with the disease and 2,100 patients without the disease. And what did they find? Well, the more mackerel, tuna, salmon, sardines, and herring that these folks ate, the less chance they had of becoming blind from macular degeneration. And guess what the magic substance was in the fish? Well, of course, it was a fish oil with omega-3s. Now, during this show, we've reviewed many studies showing that omega-3s have been very helpful for the prevention of heart disease, blindness, depression, and immune system function, to name just a few of its benefits. Everyone should be taking a daily dietary supplement to include at least 1 gram of omega-3s. Now, this is typically obtained in about 4 grams of fish oil. One thing very important here is don't confuse the amount of fish oil with the amount of omega-3s. Depending on the concentration of the fish oil, the amount of fish oil that you will need to get in order to get 1 gram of omega-3s will vary with the manufacturer, but it's not unusual to find about 25% of fish oil being omega-3. So if you want 1 gram of omega-3, take 4 grams of the fish oil. To see what else should be in your diet supplement, go to the Diet Supplementation tab on my website at drcremata.com. A complete supplement needs to not only include omega-3s, but also probiotics, coenzyme Q10, fruit and vegetable concentrates, tea extracts, and high-quality vitamins and minerals, and in the proper doses. And in our next study, can a child benefit from a supplement that the mother took while she was pregnant? Well, according to an article published in the American Journal of Clinical Nutrition, the answer is yes. These researchers found that 533 pregnant women and the children that they delivered for 16 years to test the effect of omega-3 fish oils given to pregnant mothers on the chance of their children getting asthma. So let me just give you that again. They followed 533 pregnant women, and they gave them omega-3 fish oil. And after 16 years, they wanted to know whether that had an effect on their children getting asthma. Well, their results showed that increasing omega-3 intake during pregnancy decreased the chances of their children developing asthma. These results were consistent with prior studies showing that omega-3s can regulate immune function, as it did so in these unborn children. Asthma is considered to be caused in part by an abnormally increased immune reaction, and so the omega-3s that the mothers took during this study decreased the chances of their children getting asthma. So, bottom line, pregnant women should definitely be taking a comprehensive nutritional supplement as described previously. The typical prenatal supplements commercially available or prescribed do not offer anywhere near the protection available for your developing baby as other supplements available that include high doses of omega-3s. Let's move over to our medical myth. Just how much iron is in spinach? Well, I'm sorry to have to be the one to report that Popeye has led us astray about the notion of spinach being a high source of iron. Spinach not only doesn't have any more iron content than most other green leafy vegetables, but it also contains oxalic acid, and this oxalic acid prevents 90% of the iron that it does have from being absorbed. So, does this mean that spinach isn't good for you? Well, for those who are thinking that you can now get out of eating spinach, the answer is definitely not. Spinach is still considered to be one of the most perfect foods you can eat. It contains vitamin A, vitamin C. Remember from previous shows that vitamin C can actually slow down the growth of tumors. It contains vitamin E, also important for blood vessel and heart health, B2, B6, important for nerve health, and vitamin K. And it also contains minerals such as magnesium, potassium, calcium, selenium, and copper. Spinach is also a great source of both dietary fiber and omega-3s, and it's over 50% protein. On the last show, we introduced you to Dr. McDougall, who talked about how you can get all of your necessary proteins from plant foods, and certainly spinach is a great example. Being 50% protein, it actually has more protein than, for example, eggs. So keep spinach at the top of your best vegetables list. Just be aware that if you're trying to increase your iron intake, spinach is probably not the source for that. The final study that we'll review in this section is published in this month's issue of the British Journal of Urology. They studied patients that what can sometimes be a very difficult condition to treat, chronic pelvic pain from prostate disease, and felt that this application will likely also be helpful for chronic pelvic pain caused by interstitial cystitis in women. So I really like this approach since it uses high-energy sound waves to reduce the scar tissue adhesions and increase the blood supply to the affected areas in a very safe and effective manner. Essentially, they found that extracorporeal shockwave therapy decreased pain by 44% in men that underwent this procedure. Now, based on my experience with this procedure, repeated applications may allow further benefit in some patients. I'm very aware of the power of this natural therapy, since one of my specialties is the use of the shockwave therapy for chronic elbow, heel, and shoulder pain. So I don't find this application for prostate disease with scarring and a lack of blood supply a surprise at all. Okay, it's time for a short break. Please visit my website at drcremata.com to listen to any shows that you may have missed via podcast, and refer others to the website if you want to share this show featuring our guest, Dr. Romano, with friends and family. We'll be right back with Dr. Romano in just a few minutes.
Hi, this is Kimberly, and I adopted my two best friends, Benny and Tommy, from Tri-Valley Animal Rescue. Tommy's blind in one eye and can't hear, but he's perfectly fine to me. And Benny, well, he's like a big soft teddy bear. So when you're ready to adopt an animal or even volunteer for a few hours, call Tri-Valley Animal Rescue in Dublin or go to petfinder.com. They all deserve a second chance.
We are back with our guest today, Dr. John Romano. You can learn more about him at johnromanomd.com. That's JohnRomano RomanomD.com, or call him at 510-794-5010. Dr. Romano graduated from Georgetown University Medical School and was an assistant professor in the Division of Plastic and Reconstructive Surgery at Stanford University. He recently completed his term as chairman of the Department of Surgery at Washington Hospital and has maintained his cosmetic and reconstructive surgery practice in Fremont, California since 1990. Perhaps more important than his credentials for the patient considering having plastic surgery, a good friend of mine that provides anesthesia at the surgery center where he performs many of his procedures considers Dr. Romano one of the best cosmetic surgeons anywhere for both his artistic and his surgical skills. And as those of us in healthcare know, when looking for a good surgeon, you always ask the nurses. Dr. Romano is not only a very highly respected surgeon amongst the nurses and anesthesiologists, but he is the choice of many nurses when they are looking for a surgeon to do their cosmetic procedures. With that, welcome, Dr. Romano, and thank you for taking the time to be here with us.
Well, thank you, Dr. Cremata. That was a very kind introduction. I hope we can provide some good information to your listeners today.
I am sure that you will. Dr. Romano, in today's world, and especially amongst the baby boomers, folks just don't want to feel old or look old. Now, on this show, we've recommended some natural anti-aging approaches such as optimal diets that are largely plant-based, aggressive exercise programs, chiropractic care to help maintain flexibility and joint health, and dietary supplements that include high doses of antioxidants and omega-3s. Now, we've also discussed the importance of lifestyle changes, such as quitting smoking, controlling stress, controlling alcohol consumption, and limiting sun exposure as sort of natural ways to look and feel younger. We've had an anti-aging hormone expert on the show, Dr. McCrory, and an expert in mid-range cosmetic procedures, Dr. Riopel, and he discussed things like Botox, Thermage, and the like. But as we all know, not all procedures work for everyone, and sometimes the best choice for a substantial cosmetic improvement is cosmetic surgery. And of course, this is where you come in. Can you start by telling us a little bit about your role as medical director at Aventine Spa in Livermore and at MedSpa 29?
Well, in that capacity as medical director, my role is to oversee which procedures are performed in those facilities and how they are conducted by the practitioners there.
So it's somewhat of a quality control and quality assurance to some degree?
That's correct.
Great.
And at both of these institutions, and in my own practice, I firmly believe that there should be a patient-first ethic. It's not just a customer, it's a patient. It has a different connotation to it.
Wonderful. Can you describe the typical patient that seeks a consultation with you in your office?
Well, because I do a broad range of cosmetic surgery, I can't say that there's one typical patient. For example, the most common cosmetic procedure performed for the last 2 years, i.e. 2006 and 2007, has been breast augmentation. Very often you're going to get a younger demographic of women as opposed to someone who comes in for a facelift. And that might be, somebody in their 50s, 60s, or even in their 70s. So it really depends upon the specific issue that the patient wants to address.
And what percentage of your patients are men as opposed to women?
Yeah. Currently, the statistics show that about 10% of patients are men. Still overwhelmingly a women-dominated specialty.
Okay. And what are the most common procedures that men and women request from you?
Clearly, the number one procedure in my practice since I was a resident has been breast augmentation. That is number one. Number two in my practice, again, this is for women. Number two in my practice is tummy tuck or abdominoplasty operations. And then if you're looking at 3, 4, 5, you're talking about eyelid surgery, also called a blepharoplasty, liposuction, and rhinoplasty. That's pretty much across the board in my practice as it is across the country. Now, men have a little bit different, obviously, because they're not going to ask for breast augmentation or breast procedures. The men tend to ask for rhinoplasty, which is the nose reshaping, liposuction, eyelid surgery, but also breast reduction, to treat a disorder called gynecomastia and hair transplantation, which, in fact, I don't perform. But that would be the common procedures for men.
Now, one of the things you mentioned is the thing that you do most, for example, with women, who is by far the largest group that you work with, is breast augmentation. Now,
correct.
I know that there are some cosmetic surgeons that have specialties, and I'm wondering, is one of the reasons that you do a lot of them is because you tend to get a lot of referrals for them? Is that one of your areas of expertise?
Well, it becomes an area of expertise just simply based on the volume of patients that come in. I don't seek patients per se. I don't advertise per se that I'm trying to bring in certain kinds of patients to my practice. What I offer to anybody who comes in is a good consultation. Listen to what it is that bothers them. Try to give them the information that I can that will treat their issues, and then let the patient decide how they want to approach it. Breast augmentation has just over the years been the number one most common procedure, and it continues in my practice today.
Well, that is certainly consistent with you mentioned that it's about patients. It's not about procedures or surgery. Now, I know facelifts are obviously very, very common. How long can someone expect a facelift to last?
Yeah. A reasonable time frame is to think about 5 to 7 years, and in some patients, 7 to 10 years for a true facelift procedure. What I mean by a true facelift procedure is when laypersons think about facelift, they also kind of incorporate their brow, the position of their eyebrows, and their eyelids. That's not really part of a facelift. A facelift is the procedure that's done through the incisions in the region of the ear. So anatomy can be addressed based upon where the incision is made. Obviously, you can't change the eyelids through an incision in front of the ear. So the eyelid surgery has to be separate. So there's a distinction really between full facial rejuvenation in a surgical context, which to me is a brow lift, blepharoplasties for the eyes, and a facelift, versus a facelift alone.
So is it reasonable to assume then that if you get all of the procedures done, that you're likely to get a more lasting effect then than 3 to 5 years?
Well, I'm thinking 5 to 7.
Oh, 5 to 7, okay.
5 to 7, yeah. And 5 to 7 is kind of the national range because the final result in the longevity is really more up to the patient's tissues than it is the surgical procedure itself. We all have 2 eyes, a nose, and a mouth, and look, we're all normal in that sense, but if you look around, we're all different, even with those basic structures.
Sure.
Blonde hair, black hair, brown hair, different skin colors and textures, all those things contribute to the longevity of the result. So when we look at our numbers, we're thinking at least 5 to 7 years for most people, and for the lucky ones, 7 to 10 years.
Sure. And of course, when they go in to see you, you put the 3 55-year-olds together, their genetics and their own skin are going to make them look very differently, and even the need for cosmetic surgery is obviously very different amongst individuals.
Absolutely true.
Now,
and then, as you've already alluded to, what you do with yourself over the years, your diet, your exposures like smoking, has a significant contribution to the quality of your skin and your body in general.
Now, smoking you brought up is something that slows down healing for example, spine surgeries. Mm-hmm. Is this also true for the procedures that you do?
Yes. Well, in my opinion, smoking is about the single worst thing someone can do to themselves. The reason for that is smoking, beyond the lung cancer that we know about and the lung disease that people are now becoming more aware of, smoking ruins blood vessels. And the blood vessels are the transit system in the body. They bring all the oxygen to the tissues, and it's oxygen that we want to have that keeps us alive. So if somebody loses blood supply to the heart, they have a heart attack. Somebody loses blood supply to the brain, they have a stroke. Well, when you're smoking, you're diminishing the blood supply to every organ in your body, including the skin. Healing elements are brought in through the blood supply. So if you diminish your blood supply, you're definitely going to have problems healing a wound.
Okay, well, that is certainly consistent with what everyone else has told us, and certainly if someone is going to be giving you a call for a consultation for cosmetic surgery, perhaps we can just tell them right now, make sure you quit smoking so that you end up with a better outcome from it. Okay, we're up against a short break here, so we'll be back with more of Dr. Romano in just a few minutes. Okay, we're back on the Dr. Cremata Show. You're listening to KNEW 910 on your AM dial, and our guest today is a cosmetic surgeon, Dr. John Romano. So, Dr. Romano, let's continue here with some of these questions that I have for you. We talked about facelifts and what they last and so on, and what about those more conservative new thread lifts? When is this more conservative in-office approach chosen over the typical facelift?
Great question. I have used thread lifts, and I will continue to use thread lifts if they're appropriate. They're appropriate in people who have limited problems at the present time, early problems, a little bit of jowling, a little bit of brow depression where the eyebrow's not as high as it used to be. For these things, you can put specialized sutures in the office, and it's relatively simple in that sense. But like everything in life, there's a trade. It's simple. You're not going to get the longevity out of it. They may last 1 or 2 years. Rarely are they something that's going to last 5 to 7 or longer.
Okay, so that's probably one of the downsides is how long it lasts, and then probably also just how much you can get done with strings as opposed to sutures.
That's right. Well, what happens is if you try to imagine an open procedure, a standard typical facelift where we make these incisions in front of the ear, then literally lift the skin up all the way over across the cheek towards the lips and the nose. That skin is now lifted, and we're looking at the tissues right below it. Now, we then put sutures into those tissues and elevate those deep tissues into the proper location. Then we reapply the skin, redrape it, remove the extra, and suture it in appropriately. So because you've lifted the skin, when you put it back down, it heals in with scar, and the scarring helps to hold the tissues in place. When you're doing a thread lift type procedure, you're just threading a suture under the skin in a certain way, making a loop, and when you tighten the loop up, it pulls the tissue up. But you don't have that extra scarring phenomenon to hold things in place. And I think that's why you don't get the longevity.
Sure. Well, that certainly makes sense. It sounds from your description that our listeners should only consider it then for minor areas of sagging where they are really not good candidates for a facelift. And
right. Or maybe somebody who would be a great candidate for a facelift, maybe their overall medical health doesn't allow them to go and have a surgery for 6 hours. So if they're willing to accept a little less improvement for the safety part of it, that's a fair trade. That's a balance they may choose to make.
Sure. Well, that makes sense. A lot of people that are having procedures, everybody's busy, and they're very concerned about downtime. What is the recovery time or the downtime required for some of the most commonly done procedures?
Well, if you take breast augmentation, my patients are free to do whatever they want between 3 and 4 weeks after surgery.
And what about like a return to work?
Yeah. Again, that depends on the type of work they do. But if you're not doing a lot of lifting, you can be back to work in 5 days.
Okay.
After a breast augmentation. Now, facial procedures, of course, it depends which procedure you're having, but you can have bruising and swelling for the first 2 weeks easily. And that's true even after a thread lift. So bruising is sometimes hard to hide, although women use makeup, which most men don't do. And so it's easier for them to hide the bruising. But scars and the incisions take time to fully heal. And I think after a facial procedure, I tell my patients they probably aren't going to be ready to be in public on a regular basis for possibly up to a month. And I think if you do a full facelift type procedure or full facial rejuvenation, it's a good 3 months before you really look natural.
Okay, so 1 month before the color's right, and they'll feel like people aren't sort of looking at them, and then 3 months as the tissues settle down and all the swelling goes away.
Correct.
That they feel like they can tell what effect they have. Well, that's certainly fair. Do you recommend getting more minor procedures done at an earlier age when you first start to see the jowls, and can doing this prevent the need for more aggressive procedures at a later date?
Well, I totally agree with that, and I'll take it one step further. The reason why skin ages is ultraviolet radiation from the sun and things like cigarette smoking, what other things that we expose ourselves to in the environment. So people need to be protecting themselves right from the beginning. I mean, mothers know this. They're slathering their children with sunblock now, which, of course, when we were kids, I don't know about you, but we used to put iodine and baby oil and just lay out there to get tan.
Right.
Well, you can't do that anymore.
Right.
The sun will just damage your skin terribly. So right from the get-go, people need to be taking care of their skin. And if you take care of your skin, it will last you longer, and then you can put these procedures off. Once it gets to the point in time where you feel you need something, then the minimally invasive type things are great. And what do I mean by minimally invasive? Typically injectables like Botox or different fillers, and there's many of those, collagen, Restylane, Juvederm, there's many of them. And they don't improve your skin at all, but they improve the appearance of your skin.
And do you do some of these intermediary procedures in your office as well?
Absolutely. I do them in my office, and I also do them in the 2 med spas where I'm the medical director. And these are great procedures. Botox, there were 4.5 million injections done in 2007. And just to give you something to compare that to, breast augmentation, which is the number one surgical procedure, 350,000.
Wow.
4.5 million versus 350,000. It's a great treatment. People like it. It's minimally invasive. They can just come in the office and get it and go home and they're themselves.
Right. And it's one that they repeat also, which might explain some of the numbers.
Well, that's true. Yeah, no question.
Yeah, that's a huge difference in the numbers. Well, can you offer some tips to our audience about how to choose a plastic surgeon, things to ask, things to look for when choosing a plastic surgeon, and when to kind of turn and run out the door?
Yeah. This is a really, really tough topic. I think the number one way to pick not only a plastic surgeon, cosmetic surgeon, physician, chiropractor, dentist is word of mouth. If people have gone to that person, I know it sounds sort of contrary to what the organizations will tell you, but if people are going to that person and they're getting good care, that's the person you want to go to. I think that's number one. Now, the standard answer is, well, you go to somebody who's board certified. And I can't argue with that. That's a good thing. It shows proof of education. It shows proof of experience, all up to a certain point. The problem is that not only do the good guys know this, but the so-called bad guys know this, and I'm just using that in general terms, because in board certification, there are certain boards that are recognized, and some boards just pop up. They have no recognition. They're just created without any substance behind them. For example, I mean, do you realize that there is no true sanctioned board of cosmetic surgery?
No, I did not know that, actually.
Did you also realize that when a physician, I'll use a physician as an example, I get my MD degree in 4 years of school, I complete 1 year of internship, only 1 year of internship, take my licensure exam, which is a written exam, and I receive my license. That license from that day on says physician and surgeon. 1 year of internship. As a licensed physician in the state of California, I can now call myself a cosmetic surgeon. I can call myself a urologist. I could call myself a neurosurgeon if I wanted to. I can say my practice is limited to those things. And if I do it in my office, there's no oversight. Now, if I wanted to get privileges in a hospital, I'd have to show that I was trained as a neurosurgeon to get those privileges. But if I do it in my office, I don't have to have that burden of proof, so to speak. And there are boards. I get I get letters all the time saying, come join this board, come join that board. You know, you have to pay some money and take a little written test, but there's no guarantee of the quality of the education behind it. And that's why the layperson, as is typical in all kinds of public relations, people try to muddle the facts so that it's harder for the layperson to choose. And that's why if you go to somebody who is trained in a specialty and people are recommending that person because they've been there, that's the key. That's number one.
Okay, well, that's extremely helpful in that there's not like board of cosmetic surgery or board of plastic surgery that differentiates them from the other.
Yeah, see, plastic surgery as a specialty for years was the only specialty that had cosmetic surgery within it. In other words, when I trained in my residency, we had a cosmetic surgery clinic from day one. We were trained. So it's been a part of plastic surgery. If you look at it historically, in the 30s is when plastic surgery as a specialty started. They got together oral surgeons of the day and ENT surgeons of the day and general surgeons of the day that were doing the types of things that were plastic surgery and created this new specialty called plastic surgery. And a lot of people in those days didn't want to be part of it because they thought it was demeaning. It wasn't real medicine. You weren't saving lives. You were just changing faces.
You weren't treating diseases. Well, that alone is extremely valuable information. Well, unfortunately, our time with Dr. Romano is up. You may contact him personally at his Fremont office number at 510-794-5010, or you can visit his website at johnromanomd.com, and that's John, ROMANOMD.com. If you wish to share this broadcast with a friend, please refer them to my website at drcremata.com, where they can listen to the podcast of this interview with Dr. Romano. Dr. Romano, thanks so much for taking the time to join us on the show.
Thank you, Dr. Cremata.
Okay, we'll be right back after a short break.
Hi, this is Sarah, and I adopted my best friend Lulu from Tri-Valley Animal Rescue Group in Dublin. We love Lulu, and she's part of our family now. And she loves to sit up on the couch with me and put her head in my lap. Lulu is always smiling. So when you're ready to add a dog or cat to your family, call Tri-Valley Animal Rescue or go to petfinder.com to find an animal rescue group near you. They all deserve a second chance.
We're back, and it's time for our anti-aging segment. What about aging joints? That ache or pain that you feel that makes you groan or interferes with the things that you want to do in life. Has this condition been getting worse as you age? Is there anything that you can do about it? Well, from the American Chiropractic Association website, which is acatoday.org, here's a nice summary about osteoarthritis. There is one thing to understand about osteoarthritis first is that there is something called an arthrokinetic reflex. And I don't want to get technical with you, but essentially as I go through this summary of osteoarthritis with you, I want you to keep a couple of things in mind. Number one, when joints are moving properly and through a process known as this reflex, the sensation of pain is lessened. So any painful joint, when you stimulate some different receptors called mechanoreceptors, actually that serves to reduce any pain from the joint. So sometimes just getting better motion into a joint through a chiropractic adjustment and flexibility exercises can help a lot to reduce the pain from osteoarthritis, even though it doesn't actually change the existing osteoarthritis. It changes your sensation. It changes the sensation of or the interpretation of the pain. The second concept about osteoarthritis is that proper joint motion is also necessary for proper joint circulation, lubrication, and nutrition. So it's the joint motion that stimulates receptors within the joint and the joint capsules to produce more joint fluid, and it is this fluid that lubricates and helps to heal the joints and protect the cartilage. Therefore, by getting normal motion into a joint, you not only prevent osteoarthritis because you keep the joint healthy, but you can also help an osteoarthritic joint heal by bringing in the right fluid to protect the cartilage and bringing in the appropriate nutrition. So let's go to that summary from the ACA website. The osteoarthritis, which is also known as degenerative joint disease, it affects over 20 million Americans. It's long been considered to be a natural, inevitable part of aging, but honestly, not any longer. Thanks to years of research, the development of nutritional supplements specifically aimed to heal joint problems, and education of both doctors and patients, we now know that osteoarthritis can be prevented, treated, and even cured in some cases. So exactly what is osteoarthritis and how is it diagnosed? Well, cartilage is a slippery tissue on the ends of bones whose purpose is to help them glide over each other. And what osteoarthritis does is it breaks down the cartilage, causing it to eventually wear away. Like the example I gave you just a minute ago, if you don't have enough joint fluid in there, you put this cartilage at risk. And often we don't have enough joint fluid because we don't have the proper motion in the joints. So instead of gliding, bones rub against each other and they cause pain, swelling, and continued loss of motion. So osteoarthritis is diagnosed using a combination of clinical history, patient exam, and x-rays. Sometimes fluid needs to be drawn from the joint if there's too much painful accumulation. So what can be done about osteoarthritis? Well, studies have shown us that there's a genetic predisposition to it, but just as important are the lack of exercise, being overweight, and prior joint injuries. So what are the best treatments? Well, first of all, it's important to get a diagnosis of osteoarthritis from your doctor, as its symptoms can be indicative of other problems as well. As a chiropractor, I've been trained in all aspects of joint problems, and in fact, it's our specialty. It's essentially most of what we do, whether the joints are in the spine or elsewhere. Once the diagnosis is made, there's many things that can be done to treat osteoarthritis, and these same things can help prevent it as well. These helpful suggestions, again, come from the ACA, and their website has a lot of good information if you wanted to go to acatoday.org and get more. But exercise, like we mentioned, is one of the best things that you can do for osteoarthritis. It strengthens the muscles around the joints, it improves mobility and function, helps control weight, and the endorphins released help to improve one's mood and therefore outlook, which is also very important for the healing process. You recall Dr. Bruce Lipton, our guest lecturer last week, talks about the importance of our mental state in his book, The Biology of Belief. If you want to review that webcast or that podcast, again, go to my website at drcremata.com and you can listen to that particular guest if you missed him. It's important to start with low-impact exercises, of course. Your doctor of chiropractic can put you on a program that's best for your particular condition. And will also help to relieve your pain and improve your joint function through natural therapy, such as adjustments. As we mentioned before, that improves motion into joints, physiotherapy, trigger point therapy, and massage. We'll also take a look at whether you should start on a nutritional supplement program, especially one with glucosamine and chondroitin. However, these and others can interfere with certain medications you may be taking. For example, chondroitin sulfate may interfere with anticoagulant medicine. So make sure that you talk to your doctor of chiropractic, doctor of medicine, before you start taking these supplements on your own. And neither of these have been studied in pregnant women, so make sure that you let your doctor know about any medications that you're taking and whether or not you're pregnant before you consider these particular supplements. However, if you are a good candidate, they're extremely effective. So if you're suffering any of the symptoms of osteoarthritis, which are essentially pain, swelling, loss of joint motion, give me a call at 866-521-SHOW or email me through my website, email link at drcremata.com. I'll be happy to give you a no-cost consultation over the phone about your specific condition. Let's jump over to our nutrition corner. There's a lot of good stuff in the last couple of months in the literature. From the Journal of Gastroenterology, we find an interesting article about irritable bowel syndrome. That's IBS, which is a condition that causes intermittent diarrhea, constipation, and abdominal cramping. And we're talking a lot about this, and there's a lot being published because it seems to be on the uprise. And although this condition is typically treated with 3 drugs to address whatever symptom the patient is having at a given time, we've previously reviewed a study in the Journal of the American Osteopathic Association that showed that actually spinal manipulative techniques or spinal adjustments actually worked better than the combination of drugs for this condition. So for those interested, the reference and the related podcast can be found on the radio show tab at my website, drcremata.com. Now, In this study, these researchers found that up to 40% of patients with irritable bowel syndrome can't absorb fructose or fruit sugar completely. So, bottom line, the study further supports the theory that IBS may be related to carbohydrate metabolism or faulty carbohydrate metabolism. And if you have IBS, avoid fruit sugars, avoid any refined carbohydrates, and consider controlling your symptoms with chiropractic care rather than drugs, since for most, this most natural and safer approach actually works better than the available drugs, according to the literature that has been reviewed. And next on the Nutrition Corner, what about this coenzyme Q10 that I keep talking about? Well, numerous times on this show, the invited experts and I have told you that a good dietary supplement must contain coenzyme Q10. But why? Well, in the recent issue of the Journal of the American College of Cardiology, we find one very good reason. Researchers studied 236 patients for almost 3 years. They discuss how prior studies had shown that coenzyme Q10 is useful in chronic heart failure patients, and in this study, they wanted to see whether CoQ10 levels could be used as a predictor of death from heart disease. And sure enough, the researchers concluded that coenzyme Q10 was clearly a predictor of mortality. The more you had in your blood, the less likelihood that you would die from heart disease. And as if you needed one more reason to take a supplement, this article also stresses the importance of taking a complete supplement. Too many people make the mistake of taking the latest miracle supplement in the news or the one on sale that day, and then they jump on to the next one several months later. You may know some of these people. 1 month it's omega-3s, the next month it's chondroitin sulfate, then it's vitamin D, then vitamin C, and then there's some exotic tonic found in some fruit that always grows only 4,000 miles away from wherever you live, so it's very expensive. You probably know someone like that. Trust me on this. That's not the way to choose your supplement. Choose a good product that doesn't require that you open 10 different bottles a day, one that contains high-quality and absorbable nutrients in their optimal balance, and one that includes concentrated fruits and vegetables and therapeutic levels of coenzyme Q and omega-3s. Again, if you want to know what should be in a supplement, go to the Diet Supplementation tab of my website at drcremata.com. That's drcremata.com. Whether you buy our supplement or not, the important thing is that you learn what needs to be in the supplement that you buy. Our next nutrition article is researchers compared the benefits of statin drugs. We've talked a lot about this. It's one of the most prescribed drugs. They're the anti-cholesterol drugs. And they compared them to omega-3 supplements to see if it would reduce hospital admissions and deaths. Well, 7,000 patients of over 3 years, and the study was presented at the European Study of Cardiology Congress. They basically found that the omega-3 supplements used, interestingly, in the exact dose used in our supplement product, reduced hospital admissions and death from heart disease. But the statin drugs had no effect on either death or the need for hospitalization. Now, this is big, folks. We're taking a lot of statin drugs with side effects and risks, and they're not decreasing hospitalization or decreasing death. And yet, a simple omega-3 supplement can. Here's an interesting quote from a researcher in this study. The results should humble researchers, especially as they serve as a reminder that medical decisions should be guided by science and not strongly held opinion. So, bottom line, if you want to reduce your likelihood of being hospitalized or dying from heart disease, still the number one killer in the United States, be sure that you're taking an adequate amount of a high-quality omega-3 supplement. Well, our time is up for today. I hope that you enjoyed and learned from our guest, Dr. Romano, and will implement the health information offered during the show. If you wish to share this information, please refer your friends and family members to the radio show tab of my website at drcremata.com, drcremata.com, where they can listen to the show via podcast and view the references cited. For more information about any health subject or for a second opinion about a specific health challenge, you can call me personally at 866-521-SHOW or email me by clicking on the link at my website at drcremata.com. Have a healthy and happy week, and thanks for tuning in with us this week.